Hello, my name is Ahmad Shukri bin Azmi. So, before I show you the procedure how to taping a shoulder impingement, I will tell you about anatomy of shoulder impingement. Shoulder impingement occurs when the top outer edge of your shoulder blade, called acromion, rubs again, which is impinged on. Shoulder impingement syndrome is a common cause of shoulder pain. It occurs when there is an impingement of tendons or bursa in the shoulder from bones of the shoulder. Repeated activity is one of the factors for shoulder impingement. With impingement syndrome, pain is persistent and affects everyday activity. Impingement syndrome can lead to inflammation of the rotator cuff tendons and bursa. Alright, so today I will show you how to kinesiotaping for shoulder impingement. So for the first step, I will tape at the above of the deltoid until the below of the deltoid here. So we master the end of the kinesiotaping tape this and apply for a zero tension like this. Alright, and then peel off the disc and make sure hand must straighten up and apply for 50% of tension. This one is 100% and this one is 50%. So tape this and down. So you need to rub the kinesiotaping to activate the adhesive tape. This one is the first step. So the second step is we need to apply the kinesiotaping tape from the pectoralis majors until at the extra spinatus at the back. So same step, we need to tear the end of the tape like this. Apply it for a zero tension at the end. And then peel off the white tape. Apply for 50% of tension. This is 100% and then it's 50%. And tape like this. So once again, we need to rub the tape to activate the adhesive tape. So for the final step is we need to apply at the deltoid and then around the deltoid. So we need to tear the end of the tape. And apply about 25% of tension. Like this. And rub to produce heat to activate the adhesive tape. So this is the end result of kinesiotaping for shoulder impingement. Alright, that's all.
Assalamualaikum warahmatullahi wabarakatuh. My name is Basim Gabri Karama, and today I'm going to talk about how to strap an AC joint spring. So before we go to the procedures of how to strap an AC joint spring, first we need to know about the anatomy of the AC joint spring. So the AC joint basically is where the acromion connects to the clavicle at the top of the shoulder. So this happens, the AC joint sprain happens when the ligament of the AC joint is damaged. The cause of this injury can be caused by a sudden fall or maybe a sudden blow to the shoulder. And other than the AC joint sprains, there are several injuries that can be occurred by that, such as a separation of the shoulder. So that is all for the anatomy of the AC joint sprain, and now we're going to the procedures of the AC joint sprain. Thank you. Okay, first we're going to adjust the hand. Then we're going to put it from the back to the chest area. Just put straight, just like that. Then next we are going to put the tape over it into the bicep area. And make sure we put a little pressure, a little hard on it. Then we're going to do some crossovers. So first we are going to start from the front. Just cross over it. Make sure you pull the tape. Then we're going to go from the back now. Crossover from the back. So we're going to put a couple of layers of the crossover just to make it sure it is more secure. So here I'm just going to put 2 layers of crossovers. Make sure it's pulled nicely. And now we're going to anchor from the chest to the back. So this part, it doesn't matter whether you pull it from the back to the front or the front to the back. So here I'm going to choose the front to the back because it's just easier for me. I'm going to put a couple of layers just to make sure. And lastly, we're going to put the anchor on the bicep. This just does not just secure the strapping when you go to play for sports, for any sports such as rugby, but this also prevents from blood flow, blood pump at the bicep. And so this is the example at the back until the front. So this is how you strap an AC joint.
Assalamualaikum warahmatullahi wabarakatuh. My name Muhammad Ali Beramli. Today I want to show the other type of strapping for AC joint sprain. Okay, now I want to show on how to do a strapping for AC joint pain or shoulder stability. Okay, for the first step is we need to do a anchor around the bicep like that. And after that we do a base at the shoulder, starting from the back until at the back, starting from the pectoralis major until at the back. We're doing 3 or 4 layer to cover the base around the shoulder. And also we need to make sure that the strapping are fixed to the skin, to make sure that the strapping are not easily come out. Okay, next step is starting from the pectoralis major. We strap across, bring the strapping across the shoulder to the back. We doing 2 layer, and also to make sure that the strapping fixed to the skin. Okay, we repeat the same technique, same with the what we doing at the front, starting from the back, and we bring it around the shoulder to the front, doing 2 or 3 layer. And also the key for the strapping are firm is we need to ensure that the strapping are well fit to the skin. Last step is to ensure that the strapping are not easily come out, is we need to do an anchor at the end of the strapping to ensure that the strapping can last and not easily come out. We need to do an anchor at the every end of the strapping, like that. And the very last is we need to make sure that the strapping is secure, and that is what it looks like. Thank you.
So before applying the Kinesio, we have to clean the skin very well and remove any oils. We will use 3 strips, one is full strip and another 2 is half strip. So these 2 strips I had cut it to around the corner, as you can see. Alright, firstly we need to ask the patient to stand up straight and slightly tilt his head away from his shoulder, just to stretch the skin above the shoulder. Then we take the full strip and we need to find the bony prominence on the top of the shoulder and move a bit to the soft spot, so that's going to be where the top edge of the tape will be placed. So I start with 0 stretch, and I'm going to go just below the body prominence on the back of the shoulder. I'm going to stretch this step 25%, then lay it down and placing it, and make sure it does not cross the spine. Alright, then I'm going to take the half strip and place it across the muscle in the back of the shoulder. Alright, start with 0 stretch, and then I stretch it 80% and 0 stretch. Then give it a little friction so it's adhere well. Right, for the last piece, just repeat the same step, and I'm going to place it right next to the first piece. Right, we start with 0 stretch, then 80% stretch, and 0 stretch. Lastly, give the whole thing a good rub. It's helped to create some friction and some heat, which allow the adhesive to create to active and really stick to the skin. After all, he can relax his neck and arm.
Hello and Assalamualaikum warahmatullahi wabarakatuh. My name is Megat Daniel Haikal bin Megat Amruddin. So now we're going to do the Kinesio taping for shoulder dislocate. Before that, we look into the anatomy of the shoulder. Interior shoulder dislocate is condition where your upper arm bone pops out of the socket at the shoulder blade. So now, let's start our procedure. Okay, now we're gonna start the procedure for interior shoulder dislocation. What we're gonna do first is to relax the deltoid. So what we're gonna do now is we take an eye strip and make a creasing at 2 inches at the end. We tear it and lay the tip at the front of the shoulder. We put the base without any tension. Here we're gonna follow the deltoid line down to the end of the deltoid. You can see that there is a margin line there. So here I'm gonna put the tape laying down with just about 25% of tension and 2 inches at the end without any tension. The next application is going to be put for the back side of the shoulder. Now we're going to bring the shoulder across. We take another eye strip and then we crease it for the base, and then we put it on the top of the shoulder. And again, taking the back paper off. So now I'm using my finger to guide the tape so that we can prevent the tape from wrinkling, and we stretch about 25% of tension and we bring the tape down and place it next to each other. So that's gonna be our initial 2 application. Next one we're gonna do is to try to stimulate the muscle to stabilize and pull the shoulder back. Doing this, we're gonna bring the arm across as much as we can, just like that, and we can take another hand to support it in this position. We take another eye strip, and what we're gonna do is to take the tape and place it right here, laying down behind. And then we need him to roll around a bit so we can have enough stretch here. So I'm gonna take the tape out and I'm gonna stretch it and back it off about 50% and just lay the tape down. And again, make sure there is no tension at the end of the strip. And we're gonna do the same thing with the second strip. So this is actually gonna be following more of the lower trapezius. All these things help with stabilizing your scapula. Again, stretch with full tension and back off with 50% tension and no tension on the last 2 inches. And then we rub the tape down. So afterwards, we're gonna put the arms down, back into normal position. We're going to put the last strip just below the acromion. We take the last eye strip and then we're gonna creasing it in the middle and peeling it back. We stretch it and put just below the acromion. After that, when you are going to the final about 3 inches, you're going to bring this arm sideward like this and lay the tape down. And we bring the arms forward and we lay the tape down. We're gonna aim to fill the gap right there in the back. And after that, we're gonna rub to activate the adhesive so it is properly stick. Alright, next we're gonna do the kinesio taping for frozen shoulder. Frozen shoulder occurs because the connective tissue surrounding the shoulder joint become thick, stiff, and also inflamed. Lack of use due to pain causing it become tighter, making it more difficult to move. That's why it is called frozen. So now we're gonna go for the procedure. Now we take the first tape that we make it into a Y strip. We then take out the back of the paper to put the base at the end of the deltoid. And make sure we do it in a normal hand position. Then we place the tape at the back side of the shoulder. We move the arms forward and we apply the tape following the deltoid line with about 25% tension to the top, leaving 2 inches without any tension. After that, we bring the shoulder backwards so the frontal fibers of the shoulder is stretched properly. Again, we use our finger to move the tape so it does not wrinkle with about 25% tension. And then we put both ends at the top of the shoulder. And here we have the first piece of the tape. Now we take a second piece of eye strip and then we crease it in the end of the strip and we peel off the paper. We place our base high and near the trapezius. To be able to attach the rest of the tape, we lift the medium range of the arm sideways. And then we apply about 50% tension of the strip. And then at the end of the strip without any tension. And then we take a last eye strip. We crease it in the middle and we peel off the paper. And then we make sure to apply a maximum tension on the glenoid cavity at the shoulder. And then we apply the remaining of the tape on the front side. And then we apply the remaining on the back side. We then rub the adhesive so it is activated.